Welcome to CareTalk Shorts, where we take one important healthcare idea and cover it in depth. I'm David Williams, president of Health Business Group.
And I'm John Driscoll, the CEO of CareCentrix.
John, let's talk about transparency today.
One of my favorite topics.
What does transparency mean in healthcare?
Well, I think what you're really getting at is the move from the White House and the administration to push for more transparency. But transparency in healthcare would be, from a patient perspective, you'd like to know what you're going to pay, what services you're going to get, and how you're going to get taken care of. It's really soup to nuts what you're paying and how you're being cared for.
John, I never really liked this term transparency. Now, if I think about transparency, I think about like a plate glass window and a bird flying smack into it, okay? They didn't see it. There was something on the other side they wanted. It just doesn't really
Very
resonate
esoteric.
for me.
How does that, how do you tie that to healthcare?
Yeah, because, okay, so I'm going to go to the emergency room, okay? Now, I really care. Oh, look, there's a list of all the 35,000 things they could do to me. What is that going to help me with?
Oh, come on. Don't you want to know when you go to the ER what it's going to cost? I mean,
No.
it should at least be, I think that healthcare should have an obligation, where possible, to share what the cash price is, and if possible, exactly what you're going to owe. Look, 1/3 of all Americans who have prescription drugs can't afford them. I think there's probably a lot of other areas in healthcare where people are getting bills they don't understand, or would like to know what the difference in cost is. I mean, honestly, the difference in MRIs, for example, which you can shop for, can be as much as 5 or 10 times in terms of cost. You know, whether you get your labs done at a hospital versus outside of a hospital, just across the street in many cases, can be the difference between 2 to 3 times. And those are dollars out of hardworking Americans' pockets.
Hardworking Americans. Now, my kind of people, John.
Well, but don't you think transparency,
I respect them.
Don't you think as a consumer, you should know something?
Yeah, probably. But I think when I'm going to the emergency room, I don't care about that. John, here's what happens when you make emergency room prices transparent. Who looks at those? The people that negotiate prices for emergency rooms, not the patient. Somebody says, oh, that hospital across town is getting twice what I'm getting. I'm going to jack my price up.
Not surprisingly, you're missing kind of a subtle point that's super important.
Yeah.
I think a lot of Washington is obsessed with the prices in the marketplace, and the evidence would show, economic research would show exactly what you're saying, that when you provide more information about what the big boys, hospitals and doctors, are getting reimbursed at, and provide that information in the marketplace, prices tend to go up. And that would not be helpful, or nothing happens. In New Hampshire, they've had for the last few years a law that requires healthcare pricing transparency, and it really hasn't affected cost trend. It's sort of a myth that providing more total price transparency is going to lead to lower costs. It actually hasn't affected costs at all. But I do think that the average patient really wants to know, to the extent from their insurer, from their doctor, from their hospital, what they're likely to be at risk for, because people are still going into bankruptcy who can't pay their bills. So some element of transparency, you've got to be for some element of transparency.
Okay, John. So this is a real example of the dysfunction of the U.S. healthcare system. I would wager
you and me, or
the screen? No, John. Here's the thing. I bet price transparency in healthcare is something of interest only in this country. And it's only a result of having this wacky third-party payment system. I'll tell you what transparency I care about, John. I care about the transparency related to quality. I might compare.
Great point.
Okay, that's what I care about.
But price is still, cost to me still matters, dude.
Well, I think that's already figured out what kind of health plan that you have. So, all right. So now the president has this thing. They're going to have transparency. I think it's just basically excuse for doing really nothing. You're just going to make it transparent. You're going to see it, and then Trump thinks, well, all of a sudden you won't imagine, you can't believe how much price is going to go down.
Well, there is a market myth that providing more total cost information is going to affect cost trend. It hasn't happened. It won't happen. Prices are actually likely to go up, and pricing and total cost is the biggest problem. And I agree with you on terms of transparency on quality, but what does that mean to you? How would you measure it?
Well, so John, it depends on what it is. Like if I'm going to go in.
Well, you brought it up.
If I'm going to have, so if I'm going to have surgery, I want to know, am I going to survive more likely with this doctor or with somebody else? That's what I would like to know. And I'd like to know, where do you care about price transparency? Where would that have made any difference to you?
I'm in the good fortune of having a great health plan that pays for most expensive things, but not everybody does. There's a lot of folks in high deductible plans. I think there's a small important idea embedded in what the transparency conversation is about, which is we've got to get better information to patients and family members about what healthcare is going to cost, because it still costs too much. But there's also, to your point, sort of a myth that providing more market information is going to bring costs down. We've got market evidence from states like New Hampshire and others that it doesn't actually pierce that high cost level that's continuing to go up. I love your idea on quality. Why hasn't that happened, David?
Well, I think where it has happened is in places like primary care, but then they're just talking about measures like what percentage of people got vaccinated, and it's hard to really make good comparisons to have a high enough N. And again, it actually partly goes back to the fragmented payer system, because a lot of the information comes from the claim system, and things are recorded differently from one payer to the next.
I thought, honestly, that was an easy question, because I thought you really made a good point, and you're missing the fact that we actually have more information now, to your point, than we've ever had on mortality and morbidity. I think it's important to publish that information, and to also publish just how many times doctors have done certain procedures. You know, it's pretty clear that after a couple of hundred cancer surgeries, you're a much better surgeon than your first few. Patients and consumers should know that. We should know whether certain places are good at cardiac care and cardiac surgery or not, based on mortality and morbidity statistics. Historically, that data wasn't available. Now there's a lot more data available in a wired system. So I love your idea of quality around, of more transparency around quality, but I wouldn't diss transparency in general.
So John, here's how I would reconfigure it. So
Okay.
Instead of expecting the patient to be the consumer, I would configure it so we have a value-based system where we're putting the responsibility on the primary care physician to help manage quality and cost. And I would like the primary care physician to be able to evaluate the different surgeons and have the data to do that, and their business manager or even the physician to be able to understand the different cost sides of it and have them help to manage it. And don't put the onus on the patient. That's where I'd like to see it go.
I think you've got too much trust in the system. Once you shift to value-based care, you run the risk of actually being locked into a closed system of referrals where you actually may not get the opportunity to shop for quality. People are talking about shopping for cost today. I agree with you, that's unlikely. But I would like to know what I'm going to have to pay when my kids get sick. But I actually think that what would be more powerful is more transparency around quality statistics and performance statistics and just frequency statistics available to consumers. I will bet on an informed consumer, because I think if consumers have better information about what works and what doesn't, they'll more likely go to the hospital and doctors that are driving better outcomes.
So John, last question to wrap things up here. How important is transparency in the whole kind of panoply of different solutions that we have out there? Is that an important thing in healthcare?
I think transparency is important, but a little bit like Medicaid work requirements, there's this market myth that healthcare is like every other market. It's not. When you're sick, you don't want to shop
Shop till you drop.
Shop around price. You want to shop around quality. To your point, you're completely vulnerable and at an informational disadvantage. This is a market myth, but I do think there's an element of value here that you shouldn't completely diss, which is the more information is available now than ever before. We can actually stack and rack performance statistics so that consumers can get information that previously has been hidden. And I think we can, with the tools that are starting to become from health insurers and others, figure out how much things cost. So it's a problem that we can solve, and we should, around quality and what patient's obligation to pay are, but we shouldn't subscribe to this market myth. That's my view.
All right, John, we're going to leave it at that. So that's it for this edition of CareTalk Shorts. I'm David Williams, President of Health Business Group.
And I'm John Driscoll, the CEO of CareCentrix. Thanks for watching. Hey there, listeners. Want more CareTalk? There's more to be had in our other episodes, so be sure to look for those and subscribe to CareTalk on your favorite service.